Hello! One of my favorite things to look out for when I'm interning or working is how people communicate. Because I think that's the stuff that's not being taught in school. And as I went along PT school, I've learned little communication gems here and there. It can be an analogy that someone used to help explain a complex concept to a patient, or it could be the way someone reassures and educates the patient. You know, every therapist communicates a little differently, and that's okay. Some are high energy, passionate, go, go, go. Some are more calm and collected. Some are more loving than others. Some are more authoritative and stern. People are different and have different personalities. I'm sure you have heard of the importance of getting a good subjective. It's a reoccurring theme from professors, CIs, clinicians, mentors, whoever you talk to, because it's the foundation of your treatment. It's how you get all the information you need. Mechanism of injury, ruling out red flags, what their goals and expectations are, and really it's how you start building a relationship with patients. Atul Gawande is a famous author and surgeon in Boston. In his book, he talks about the current state of end-of-life care in the medical system from a surgeon's perspective. And he also discusses the different communication styles that medical doctors have. The first type of communication style, he says, is the paternalistic approach. This is the traditional old school style that's much more common in the past. In this style, I am the provider and I know what's best for you, and I'm gonna tell you what's best for you. We are the medical authorities aiming to ensure that patients receive what we believe is the best for them. We have the knowledge and experience. We make the critical choices. If there were a red pill and a blue pill, we would tell you, take the red pill, it will be good for you. I am the provider and I make the decisions for you because I know what's best for you. The second approach, he says, is the informative approach. He says that this approach is much more common now, and in theory it works pretty well. Because instead of telling you that I know what's best for you, I'm just gonna tell you the red pill does this and the blue pill does this, and the decision is on you. So it's kind of like the opposite of the first approach. Now the decision is on the patient. We tell you the facts and figures, the rest is up to you. Here's what the red pill does, here's what the blue pill does, we would say. Which one do you want? It's a retail relationship. The doctor is a technical expert, the patient is the consumer. You know, in theory this sounds pretty good because the patient is informed and they can make the decision and choose whatever they want. But wait, Gawande argues that there's a third approach that's even better. He states that deep down, neither of the previous approaches is what people truly want. The third approach, he says, is the interpretive approach. Here the doctor's role is to help patients determine what they want. Interpretive doctors ask, what is important to you? What are your worries? Then when they know your answers, they tell you about the red pill and the blue pill and which one would most help you achieve your priority. In this approach, he states that the decision-making process becomes shared. Even though he's mostly talking about medical doctors, I think there's a lot we can learn as physical therapy clinicians, changing the interactions with your patients from I know all the answers and I'm gonna fix you to more of a team approach. I think there's huge value in listening and understanding what patients' goals are and what motivates them. And you know what? I've seen both sides of the coin. In some of the more busier clinics that I've worked at, unfortunately there's not enough time to educate the patient. They say don't ask open-ended questions, make sure you get the information you need, tell them what's wrong with them and work on them. And by working on them, they mean manual therapy, massage, make sure they schedule 3 times a week, and goodbye. But the question is, does that work? Technically, yes, because people do get better. But again, this goes back to the dependency problem. People are forced to come back to you because they only feel better when you work on them. I think this is why you hear people saying, yeah, PT helped, but it only helped when I went. And when I stopped going, the pain came back. On the other side of the coin, I've also worked with PTs who embody the interpretive approach. They spend the majority of their time during an evaluation on truly understanding the patient. Personally, I think this approach creates a much better clinician-patient dynamic, and it increases therapeutic alliance because the patients will start seeing you as a friend who really has their best interest in mind. And when that happens, patients feel more supported and they want to come back and they want to do exercises. And personally, I want to strive to adopt this type of approach when communicating with patients. So what are your thoughts about the different type of approaches? What do you see most out there? As always, if you enjoy this type of content, subscribe because there's more to come.